Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to talk about Lyme disease. I look forward to seeing the questions you have in store for me tonight and what directions we wind up going here. And I look forward to seeing if you stump me, because sometimes you do. For those of you that are new here, welcome. Glad to see you here. If you are new, there's two ways you can participate. Number one, you can listen in on the questions as I read them. Also, you'll be able to see them on the bottom of your screen and see what responses I give. There's usually some good information you can pick up that way. The other way is to actually write a question to me. The way you do that is on the bottom of your right-hand side of the screen is a chat box. You can write your question to me using that chat box function. The only thing I ask is do not try to use the enter key to create multiple paragraphs. Every time that you hit the enter key, it actually sends a separate question to me, and that can be very difficult to follow your question if it has multiple parts to it. So please only write your question as one big long run-on paragraph, and then send it to me that way, okay? And although I said long paragraph, also this format does better with shorter questions, not really long, elaborate ones, okay? So keep that in mind as you're writing your questions as well, too. Tonight is our third webinar of 4. So tonight and then next week, I'll be doing another one too. I am creating a recording of tonight's webinar. And if everything goes as planned, I should be able to get a synopsis of that out to you tomorrow morning, along with an edited version of the webinar as well too. And I said, if everything goes as planned. Sometimes the recordings don't take place as they're supposed to, but usually they do. My intention would be that I get that out to you tomorrow morning somewhere before 9:30 a.m. Pacific Standard Time. Sometimes that doesn't always go as planned, but that's what my plan is. Tomorrow morning, when you get that email from me, it will have a place in it that you can sign up for next week's webinar as well too. I ask if you're getting benefit out of these webinars that you actually share this information with others. Keep in mind, if you're getting benefit, others probably will get benefit as well too. So send the email that I sent announcing that the recording is ready, along with the synopsis. Send it to people you think might get some benefit, either by the information I have, or they might get benefit for participating in the next series of webinars as well too. All right. So I think that pretty much takes care of it. I think without any further ado, let's go ahead and get started here. All right, this first question is from Sherry. Hi, Sherry. Let's see, I have chronic Lyme going on 10 years. Fatigue and pain are unbearable some days, and any exertion results in even more fatigue. Recent blood tests show high ANA, thyroid globulin antibodies of 124. My GP says these results are unimportant because I don't have abnormal inflammatory markers like CRP. Is my GP right, or could any ongoing symptoms be autoimmune? So in chronic Lyme disease, one of the things we see is that these standards inflammatory markers like a C-reactive protein, which is what CRP is, and another one called a SED rate, also ESR is what that's called, they often can look normal. They're probably better indicators of more acute inflammation than they are of chronic inflammation that we see with infectious states. In infection states, the reason that you are all inflamed is due to a group of chemicals called cytokines. And the CRP and SED rate are not necessarily the best indicators of looking at cytokine levels, unfortunately. So they're not always accurate. You have to go more with the clinic symptomatology is telling you in tick-borne illnesses, okay? All right. Thanks for the question, Sherry. Good luck to you. Barbara says, hi, Dr. Ross. Hello, Barbara. Hello, MM. Let's see, hi, Dr. Ross. I understand that restless leg syndrome can be related to peripheral neuropathy. I feel restless leg syndrome in my legs, feet, trunk, and head, and have recently had increasing neuropathy. It is preventing me from getting a good night's sleep or even sitting and working in comfort during the day. I feel like I need to crawl out of my skin. Any suggestions for this? And is this common thing to see in Lyme and co-infections? Thank you. So restless legs is this feeling that you have to, that something is on your legs and you have to move them, basically. It does occur in tick-borne illnesses, but also can occur separate from tick-borne illnesses too. One of the foundation treatments for somebody with restless legs is to look at your iron levels and see what they are. And if you have low iron levels, as evidenced by having a blood test called a ferritin. Ferritin is the storage form of iron. If your ferritin is 40 or less and you have symptoms of restless legs, often taking iron can make a big difference for that. The other thing that we tend to see in people with restless leg syndrome, if I'm looking at the big three tick-borne infections, the big three would be Borrelia, which is Lyme, Bartonella, or Babesia. When restless legs are present, we often think Bartonella is likely to be there. And so I would look to see if you have other Bartonella symptoms as well too. And if you have enough other Bartonella symptoms, then part of the treatment for the restless leg is going to be get your Bartonella under control too. So symptoms that can suggest restless leg syndrome are pain on the balls of the feet, a lot of neurologic agitation, which could either be the restless legs. It could be also a feeling of vibrating or buzzing on the inside. Sometimes people actually have tremors or shakes or seizures with their neurologic irritation. You also can get neuropathy, so numbness or neurologic pain, like sharp shooting, stabbing, burning, piercing, electrical types of pain as well too. People with Bartonella often have severe cognitive impairment, so bad thinking problems that are kind of out of proportion relative to the difficulty you're having with energy, for instance. Okay, so like maybe your energy is 50% bad, but your thinking is 90% bad. Okay, just as an example of that. Okay, and then finally, sometimes people with Bartonella will have a feeling of air hunger. They can't get enough air from time to time. We also do see that with Babesia, but sometimes that happens in Bartonella too. And then last, there's a physical finding that some people with Bartonella have, and that is sometimes people with Bartonella get these scratch marks that look like scratch or stretch marks that you can see as a result of having Bartonella too. So part of treating restless legs, if it's there, if you have Bartonella, is going to be oriented at also covering with your antimicrobials for the Bartonella as well too. Okay, all right. And then finally, there are medications, anti-seizure medications that you can use to get the legs to stop moving and to stop that sensation. That can sometimes be helpful if it's really bad and iron is not working for it. Okay. All right. Good luck to you, MM. Thanks for the question. Hello, Robert. Hi, Dr. Ross. Is cinnamon clove oregano oil as effective and active Bart and Lyme as the herbal tincture combinations? I can only tolerate 1 pill a day along with 30 drops Japanese knotweed 2 times per day. I've been addressing persisters and previously focused on the active Lyme. I'm concerned that I'm not killing all active bacteria. Also, would symptoms of persisters be in line with their active counterparts? Thanks for these awesome webinars. You're welcome. All right. So in terms of herbal medications that can treat growing and persister Lyme and growing and persister Bartonella, there are 3 big ones that can do both of that. Okay. So one is to use this combination pill that has cinnamon clove oregano in it. And generally, I like using that as 1 pill twice a day. I also like that compared to other options because the oils can also help break down biofilm this way too. Okay, so the company that makes that is a company called Dr. Inspired Nutritionals, and their product is called liposomal cinnamon clove oregano essentials, and you would do 1 pill twice a day. There are some people that's too strong for, and in which case I will just use 1 a day and we still get some benefits from it. Okay, all right. Other herbal options to treat growing and persister forms of Lyme and Bartonella include Japanese knotweed, and also Cryptolepis is another one. Cryptolepis, many of you may know, also is an herb that can treat parasites, and especially the blood parasite called Babesia that some people with tick-borne infections get. But according to research that came out last year, laboratory research, it looks like it's pretty effective against treating growing and persister Lyme and growing and persister Bartonella as well too. Okay, now the knotweed and the cryptolepis, as I said, probably are not going to be as effective against biofilms as what the cinnamon clove oregano is. And so for that reason, my go-to tincture that are herbal medicine that I tend to use when I'm trying to address persisters is the cinnamon clove oregano, because we also get biofilm out of it, okay? But as another alternative, you could do the knotweed or you could do the cryptolepis, either one of those. Now, if you are only able to tolerate one a day of the cinnamon clove oregano, that's fine. It's probably doing something good, useful for you as well too, okay? Let me see if I covered your question here. All right, I think I answered your question. Let me just talk about something for those of you that are not familiar with all these terms. Let me just go through it real quick. So both Lyme and Bartonella have a majority of the germs are in a growing state, and a small percentage, maybe 10, 20%, exist in what's known as a persister, or you can kind of think of it as a hibernating state. Why this is important is about 4 or 5 years ago, we started wondering if these persisters, after they were discovered, are one of the reasons we have difficulty getting people well from this illness, because the majority of the antibiotics we have historically used to treat these infections tend to target growing, not persister form, okay? Now, in addition, in terms of terminology, in addition to these terms, persister and growing, the Lyme germ also has different appearances, what it looks like, okay? So Lyme has something called a corkscrew. We call that a spirochete. And Lyme also has another form that moves inside of cells. We call that the L form or intracellular form. And then finally, there's a third form of the Lyme germ, which is a microscopic cyst, okay? The thinking is that both the spirochetes and the cysts can be growing or persisting, okay? Intracellular or L-form Lyme, we really don't know if it can go into a persisting state because it lives inside of cells and we're not able to look inside well enough to see that. Okay. All right. Good luck, Robert. Oh, last thing. So in my treatments, I'm always making sure that I have somebody on something that's going after the growing and something that's going after the persister. Okay. All right. The thing that's nice about the cinnamon clove oregano or Japanese knotweed or cryptolepis is all three of those go after growing and persister, and they can handle growing and persister Lyme, growing and persister Bartonella as well too. Okay. All right. All right. Hello, Barbara. Again, let's see. I have two questions. Does grapefruit seed extract interfere like grapefruit juice? That's a good question. So, many of you may be familiar with the fact that grapefruit juice has a chemical in it that can interfere with the metabolism of certain medications. That chemical, there's a name to it, and I'm blanking on what that name is. That chemical is found in grapefruit seed extract, but at microscopic amounts. And my experience is, and how I use it is that the microscopic amounts are too small to really interfere with any liver metabolism of various medications. And so even though some medicines are not supposed to be used with grapefruit seed or grapefruit juice, they are okay to use with grapefruit seed extract, okay? So for those of you that aren't familiar, the reason we use grapefruit seed extract is it's an herbal medicine that can treat the cyst form of the Lyme germ. I was talking about that form earlier. It can treat the cyst form of the Lyme germ. Okay? All right. Good luck, Barbara. Thanks for your question. Hello, Eleanor. Hi, Dr. Ross. I am positive for Bart and Babesia with severe symptoms of each infection. Would this be a good protocol that covers the infections? Doxy, methylene blue, which I think is what you mean by MB, mepron, rifampin, crypto tincture, cinnamon clove oregano, and Beluki. Also, can Bartonella just cause joint inflammation? How quickly should this resolve if the treatment is working? Is it okay to start at pediatric dose of rifampin and work up? Thank you. All right. So there's a lot of parts to this. So first of all, when you have Babesia and when you have Bartonella, if you are on a treatment that is working effectively against those germs, the symptoms of those germs, related to those germs, should start to improve within 1 to 2 months. If they are not, then you may need to reconsider what you're using to treat, okay? By comparison, the Lyme infection, symptoms that are attributed to it, sometimes can take 6 to 9 months to improve. In fact, there's been a study done looking at how quickly do your symptoms turn a corner when you're treating Lyme. And in this study, people were put on the antibiotic clarithromycin along with the antibiotic flagyl, also known as metronidazole. And they were watched to see when did they start getting better. And what it was found is that by 3 months, 30% of people started having improvements. By 6 months, 60% of people started having improvements. And by 9 months, 90% of people started having improvements. Okay, so Lyme takes longer. But if you're on an effective treatment for Bartonella or an effective treatment for Babesia, symptoms attributed to those infections should start to get better. So for instance, for Babesia, if I've got somebody that's got drenching night sweats and air hunger and maybe even a lot of deja vu experiences, for instance, those are some Babesia symptoms. If I get them on a Babesia treatment that's working, by 1 to 2 months, I should start seeing decreased sweats, decreased air hunger, and decreased deja vu experiences, okay? The same, we went through Bartonella symptoms earlier, we would see decreasing Bartonella symptoms if that treatment was working too, okay? All right, now this treatment that you've come up with here, the doxy plus rifampin plus crypto plus oregano cinnamon clove oil plus methylene blue would handle Bartonella, and all of those would handle Lyme, okay? They would handle growing and persister Lyme, growing and persister Bartonella, okay? The doxy mepron crypto portion would treat Babesia and is a good treatment for that. Okay, now, I would suggest you don't need to be on all these things. Keep in mind, even though some of these are herbs, the more things you add to your treatment, the more interaction problems you could get, and also a greater chance of disrupting the good microbiome. So in this treatment, the methylene blue, the crypto, and the cinnamon clove oregano are all things that are going to treat persister Lyme and growing Lyme, and also persister Bartonella and growing Bartonella. And I usually would not do all three. I would usually do one. And if you were my patient in this kind of a situation, if I was treating Bartonella, Babesia, and Lyme together, I would probably do this as a doxy, mepron, rifampin, crypto, and not do the methylene blue and not do the cinnamon clove oregano because you've already on something for persisters with the crypto. The reason to leave the crypto in here too is it's also part of a Babesia treatment. It can kill Babesia as well too, okay? In terms of biofilms, the Beluki is going to do two things for us. Number one, it's going to treat biofilm that I mentioned the cinnamon clove oregano can do, but Beluki can do it too. And also the Beluki, which is an enzyme called lumbrokinase. It's enzymes that come from earthworms. The other reason we use Beluki in a Bartonella or a Babesia treatment is to help deal with something that can limit treatment, which is called fibrin nest. Okay, so when you have Bartonella or Babesia, they can mix themselves, intertwine themselves with the blood clotting protein in your blood called fibrin. And if they mix themselves with fibrin, they can create these nests of germs and fiber that stick themselves on your blood vessel wall where they kind of are hard for the immune system to get at and for your herbal or prescription antibiotics to get at. Beluki can help break down the fibrin in the fibrin nest. Okay, so that's why you would use a Beluki here. In addition, biofilms, which are something different, a slime layer that covers germs, especially Lyme and Bartonella, the part of a biofilm is made up of fibrin with this sugar slime layer, and the Baluchi breaks up the fibrin in the biofilm and breaks the biofilm down as well too. Okay, all right. So I'm not so sure. I mean, this treatment would work, but I think you may be going overkill. And increasing your toxicity risk and increasing pressure on the good bacteria within your intestines as well too. Okay, all right. So those are my thoughts. Rifampin, usually when I start somebody on rifampin, typical adult dose is going to be anywhere from 600 to 1,200 milligrams. Usually I am going to use more of a 600 milligram dose. And so often I'll start at 300 milligrams one time a day. By pediatric dose, I think you need 150 milligrams. I mean, you could start there as long as you're willing to work up based on how your symptoms, whether you get a herx, and if once that herx lifts, I would then start increasing again. Okay. All right. Thanks for the question, Eleanor. Good luck. So everyone, let me just do a quick screen share here. And I want to show you a few resources for those of you that are new to some of these concepts here. There we go. All right. So this is my information site on how you treat Lyme disease, okay? And this is the online guide. This is where most of the information is that I have. And if you want to take a look at, to get information about treating persisters, take a look at my infection treatment plan section here. And in here, I talk about different options that you can use to treat persister Lyme and persister Bartonella, okay? And if you want a more comprehensive approach that talks about just how you approach Lyme in general, Lyme disease antibiotics, you can click on this one. And for Bartonella, you can click on this article here as well too, okay? All right. In each of these articles, I just want to show you something about the Baluchi, which is also known as lumbrokinase. As I talk about how to treat, oops, wrong article. Let me go back. My Bartonella one, in both my Bartonella guide and in my Babesia guide, I talk about why it's important to use something for fibrin nest, okay? And so you'll see my discussion of that right here. And then in terms of what you use, as you select, these are all antibiotic combinations you could use. But then in terms of the importance of removing these fibrin nests, I have it as a separate standalone step that you would do along with your antibiotics. So it's step 4. And lumbrokinase is what I use. Lumbrokinase is Baluchi is the brand name of one kind of lumbrokinase product that's out there. Okay? All right. Hello, Barbara. And does knotweed increase estrogen if you are estrogen dominant? You know, I haven't seen Japanese knotweed increase estrogen. It just has not been my experience. In terms of herbs that we use as antibiotics to treat the Lyme infection, one of those herbs is cat's claw. And I have seen that cat's claw has an estrogenergic effect or an estrogen effect. That has not been my experience with the Japanese knotweed, though. Okay? All right. Good luck to you, Barbara. Hello, Yanni. Let's see. Hi, Dr. Ross. Thanks so much for all the valuable advice you offer us. You're welcome. Last week, you were only able to answer part of my question because only part of it showed up in the chat. So here's the rest. Do you know of an experienced Lyme literate physician somewhere within New York to Philadelphia East Coast corridor that can guide me through the Bartonella diagnosis I just got? I'd rather not try to figure out how to treat myself on my own. My integrative physician is not well versed in Lyme and mold. All he recommended is a product called Lymogen by Jernigan Nutraceuticals to help with the Bartonella. 2 weeks ago, I learned through some IGeneX labs that I am positive for Bartonella. I am IgG positive for the genus, Bartonella henselae, Bartonella cantana, as well. I was IgM indeterminate for Bartonella genus, Bartonella species. I have some of the classic Bartonella symptoms: high anxiety, major insomnia, occasional air hunger, occasional electrocytes throughout my body, and brain fog. All right. Within the New York to Philadelphia East Coast corridor. Let me look something up here. So out in that area, there is a doctor, I think it's Kenneth. There's two Dr. Bachs, and I think it's Ken Bach that's in lower part of New York State. Bear with me here. I'm going to do a screen share, and then we'll look at this together. Yeah, he's in Red Hook. So Dr. Kenneth Bach, who is in Red Hook, is a physician I'm familiar with that does work with, what's going on here? That is able, that could probably give you some help with this, okay? That's one person. There's another person. It would be a little bit north of that corridor up in Fairfield, Connecticut. And her name is Jennifer Letitia, and that's Letia. She is an integrated medicine physician that treats mold toxicity illness as well as tick-borne infections, and is very knowledgeable in the approaches I use, for instance. And so she's somebody also to think about up in that part of or out in that region of the world too. Okay. All right. Good luck to you. Hello, Frank. Hi, Dr. Ross. Thank you for all of us Lyme sufferers. Can Lyme or co-infections lead to thyroid issues? Good question. The answer is yes, in a number of ways. And thanks for your comments as well, too. So when you have tick-borne infection, whether it's Lyme, Babesia, Bartonella, Ehrlichia, Anaplasma, those tick-borne infections trigger too many cytokines. And I think you've heard me mention that before, but let me just briefly describe it to everyone, okay? So everyone, what your white blood cells, when they see an infection or they see a toxin in you, in terms of trying to get rid of that infection or toxin, make a bunch of chemicals called cytokines. And there's a variety of cytokines they make. What cytokines are supposed to do is try to turn on the immune system by causing more white blood cells to be made, helping draw those white blood cells to where the infection is, and help those white blood cells work better, okay? But in situations where the immune system doesn't do a good job, it eventually makes too many cytokines because it keeps trying harder and harder, okay? And too many cytokines give you a variety of problems which look like Lyme disease and look like what mold toxicity symptoms are, which are really both excess cytokine syndromes, okay? So symptoms of too many cytokines are sleep disturbances, insomnia mainly, difficulty thinking, low energy, body pain, joint pain, dysfunctional nerves, and also hormonal dysfunction. So increased cytokines interfere with the part of your brain called the hypothalamus pituitary and its ability to direct your thyroid and to direct your adrenal glands and your hormonal systems in general to work correctly, okay? So it is possible to get low thyroid predominantly from excess cytokines because the brain does not provide the correct signals, okay? So that's one possibility. Second possibility is Lyme can trigger autoimmune illness, of which one type of autoimmune illness is something called Hashimoto's thyroiditis, where people actually develop antibodies that start attacking the thyroid. And we think Lyme may be a factor in that as well, too. So sometimes you can get either hyper or hypothyroidism related to inflammation of your thyroid. Sometimes at first, when the thyroid is really inflamed with Hashimoto's, it sometimes will make too much thyroid at first. But eventually, because of that inflammation, the thyroid starts to burn out, and then people start having low thyroid after that. Okay. But those are the two big things I think of. Okay. All right. Thanks for the question, Frank. Good luck to you. And actually, Frank, let me just show you something, because there's, in terms of how do you test for thyroid in this illness, I'm just going to show you a quick article. So if you look in my guide and you look under the hormone section, I've got a pretty extensive article about testing and how you evaluate the thyroid in Lyme and tick-borne illnesses. Okay, that's this article right here. All right. All right. Hello, Yanni, again. Let's see. Periods have been super hyper, dysbiosis, etc. As well, I have eye mold. Oh, okay. Yeah, I still, without going through your full specifics of your questions, in terms of who to work with, take a look at those two physicians that I suggested earlier. Okay. Hello, Brian. Let's see. I've read that long-term antibiotic use can cause issues with mitochondria, specifically, in my case, azithromycin. How can I tell if brain fog is caused by an infection or mitochondria dysfunction? Second question, curious if you have investigated NMN at all for energy and brain fog. So, no, I have not investigated NMN, and I'm not even familiar with what those initials mean, so I would not say that. And also, I think you may have asked me this question last week. I know that Dr. Lidner, who treats Babesia, has some belief, and I use the word belief, that the brain fog that comes about is due to mitochondria dysfunction. And as I indicated last week, I'm not so sure. Well, let me clarify that. So in terms of brain fog, a bigger cause of brain fog is the excess cytokines, okay? Now, if you lower cytokines by getting your germs under control, that brain fog will start to clear. Now, let's talk about what brain fog means. So brain fog can mean a number of things depending on who you're talking to, okay? And everyone uses it a little bit differently. For some, when they use the word brain fog, they mean they have a cloudy feeling around their head. For others, it means they have dysfunction of their ability to think. They have a hard time with memory, processing information, okay? And even that memory processing information issue can be cytokine related. So initially, what I like to do in those situations, get your germs under control, start treating them, get on something that lowers cytokines, like curcumin, curcumin phytosome by Thorne, for instance, what I like to use, 500 milligrams 3 times a day. And also some of that brain fog can be due to toxin buildup from the germs, and getting on glutathione can sometimes help with that as well too. So, and the glutathione I like using is a form of glutathione that can be well absorbed. Glutathione, everyone, is a very strong antioxidant that is made in every one of our cells in the body, and its purpose is to repair damage from the inside, okay, including damage in mitochondria from the inside, okay, but also it's used by the liver to help detox things. And finally, as an antioxidant, it decreases the signals that tell white blood cells to make too many cytokines. So when I've got brain fog, I want to put people on the germ killers to get their germs under control. I want to get on herbs that help lower cytokines, like curcumin phytosome, 500 milligrams 3 times a day. And I want to be on glutathione to improve detoxing, and also it helps lower cytokines as well too. And that would be to be on a liposomal variety so that you get absorption. And the product that I like for that is a product by Research Nutritionals called Trifortify. And I'll have people take 1 teaspoon once or twice a day. That would be my initial approach before I even start thinking about going after mitochondria. Often mitochondria are not dysfunctional. Once you clear the cytokines and you get the germ load down, mitochondria are working just fine under it, okay? Now, if I've got somebody that I've been treating with their herbal or prescription antibiotics, and I've also got them on the anti-cytokines and got them on glutathione, and that brain fog is not starting to lift by about 6 months, then I might start thinking about doing activities to rebuild the mitochondria. And what I like to use to rebuild the mitochondria are phospholipid complexes made up of something called phospholipid choline, phosphatidylserine. Phosphatidylcholine, phosphatidylserine. These are the fats that make up the mitochondria membrane. And also these are the fats that make up your cell covering membranes as well too. And what a product that has those in it is a product called ATP 360 by Research Nutritionals. I usually have people take 3 pills 1 time a day. They've got good data showing improvement in thinking and improvement in energy. It usually takes 1 to 2 months to see benefit, and you're going to need to use those for about 6 months. Okay. Now, I should step back here for a minute. Everyone, mitochondria are your energy factories found in every one of your cells. Okay. And by some estimates, there's 300 to 400 mitochondria in a cell. One of the things that happens when you have infections is the immune system, and trying to get these infections under control, manufactures oxidizing agents. And oxidizing agents may damage germs, but they damage the covering of your mitochondria, and it can damage your cell membranes as well too. Okay. Now the mitochondria and your cell membranes can repair themselves if you get rid of the insult. So what I like to do is get rid of the insult first and lower those cytokines first and pull toxins out first. And if that, after doing that for about 6 months or so, it's not doing well enough, then I want to step in and start doing repair work. Okay. Now, one other word of caution. If you are using, as part of your Babesia treatment, something that has atovaquone in it, which would be atovaquone, or a product called Mepron, which is all atovaquone, or something called Malarone, which is a combination of atovaquone with something called proquinel, any of those, coenzyme Q10 can interfere with the effectiveness of the atovaquone. So therefore, you would not want to use an ATP 360 because that product, in addition to having these phosphatidylcholine and phosphatidylserine and other useful phospholipids in it, has some coenzyme Q10 in it too, okay? So your alternative, if that's the case, is a different product by Research Nutritionals, which is called NT Factor. NT Factor doesn't have any CoQ10 in it. It has a mix of these phospholipids, and the way you dose that is 2 pills 3 times a day, okay? All right. Good luck to you, Brian. Hello, Eleanor. Hi, Dr. Ross. I'm positive for Bart and Babesia with severe symptoms of each infection. Oh, we already answered that. You asked me twice. All right, let me get rid of that. Hello, Mary. Hi, Dr. Ross. Do you feel Bactrim, Biaxin, and Simiclove work well for Bartonella? Thank you. Yeah, I mean, that can be a viable combination. So Biaxin and Bactrim are effective at treating growing Bartonella, and a liposomal cinnamon clove oregano would be an agent that you could use to treat the persister side of Bartonella as well too. So that's a combination I've used with my patients before, and that can do well. Yeah. Good luck to you, Mary. Hello, Goalie. Let's see, Dr. Ross. Thank you so much for holding these webinars to help us. You're welcome. We truly appreciate your time and compassion. Thanks. For Lyme, I want to take methylene blue as suggested with azithromycin. How long should I be on this? Thank you. So, generally, as I said before, if an agent is working, if the combination of things you're on is helping with Bartonella, usually by 1 to 2 months, you're going to see benefit, okay? And if you are, but you're still symptomatic, you probably will, because it takes about 4 to 6 months for about 85% of people to recover from Bartonella on a treatment that's working. So at a minimum, if they're working, I'd use them for about 6 months. If they're still working and you're getting still improving after 6 months, then stay on them even longer. But yeah, probably you're going to be on these for about 4 to 6 months, probably. Okay. All right. Good luck to you, Goalie. Hello, Barbara. How accurate is live blood dark field microscopy in seeing Lyme? It's so dark field microscopy is a way of seeing spirochetes under the microscope. The trouble is, Lyme is not the only spirochete. So when they're seeing spirochetes, it may not necessarily be Lyme. And I don't know that this has actually been a validated method of finding if you have Lyme or not. I wouldn't rely on it in my treatments, actually. Okay. All right. Thanks for the question. Hello, Crystal. Question about the role place for ivermectin treatment of Lyme and other tick-borne infections. My diagnosis of Lyme, 3 strains of Bartonella and European babesiosis, has not responded to 3 treatment courses, one of which has herbal, and then did 2 rounds of combo IV infusions. What role does ivermectin play in treatment? Is it a first-line treatment or a go-to later on once other options haven't worked? Okay, so we got, during the pandemic, we got into a place where everyone started thinking that ivermectin was a wonder drug that could kill anything, whether it's COVID, whether it's parasites, which is what it's designed to do, whether it's Lyme, etc. Okay, that's just my commentary, okay? And my other part of that commentary is ivermectin is not a wonder drug that kills everything, okay? Ivermectin was designed as an antiparasitic. That's what it was designed to do. At first, during COVID, when some of the initial information came out about ivermectin and COVID, saying it might help, I thought it's possible. But I knew that research that first came out was basically conducted by people that were big cheerleaders of ivermectin. And they lacked objectivity that you would see in well-conducted research. Subsequent research that has come out would call into question whether ivermectin actually is effective against COVID. When you do double-blind, randomized controlled studies, not conducted by the cheerleaders, that data is suggesting ivermectin is not a good agent for COVID. Okay, so number one. Okay, in terms of Lyme, the Lyme infection, there has not been any research done that has been done to look specifically at whether ivermectin kills the Lyme germ. Okay, there is no research that says it does. What we do know, though, is that ivermectin can modulate and regulate cytokine levels. So there are people that do use ivermectin in their Lyme treatments, and they report that they're feeling better. Probably it's because of altering cytokine levels and not necessarily as a germ killer. What I have seen in my practice, I don't use it as a germ killer in my practice. I have had people that have come to see me who did use it as germ killers, and basically it seems like it fails as a germ killer. Okay, so I'm skeptical of it there. May help with symptoms, but more as an anti-cytokine agent. Okay, all right. In terms of Babesia is a parasite, and ivermectin was designed as an antiparasitic. There is 1 or 2 studies I've seen that suggest it might, and I hope you hear my words, suggest might. In other words, this was not conclusive studies, but there's some limited studies that say maybe it helps with Babesia as a germ killer. Okay, but in terms of helping with anything else, I wouldn't rely on it. I'll put it that way. Okay, all right. And I probably wouldn't build a whole Babesia treatment around it either. I think it's something, if I'm treating Babesia and everything else has failed, then I might look at ivermectin, but I wouldn't build everything around. I think ivermectin has got a lot of cheerleaders out there, and I think it's way overrated for what it can actually do. That's my opinion on it. Okay. All right. Thanks for that question, Crystal. Hello, Ricky. Hi, Dr. Ross. How long would you wait before changing your treatment protocol if it's not working for Bartonella and your symptoms are not improving? Thank you. So, Ricky, I think I've answered that before tonight, but just in case you missed that, and I know you may have written this before I answered the previous questions too, but generally, if a Bartonella treatment is working, by 1 to 2 months, you should start seeing a reduction in the Bartonella symptoms, all right? I didn't say they would be all gone, but you should be starting to see some improvements in those symptoms. And if you're not, then it's time to change the treatment, okay? All right. Good luck to you, Ricky. Hello, Paula. Let's see. Should you treat parasites first before Bartonella? If so, what are the best meds to get rid of liver flukes? So, Paula, I only treat for parasites if there is a possibility they're there, number one. Okay, I'll just start by saying that. But in terms of liver flukes, I don't know off the top of my head what works best against them. I would have to look that up. So I can't tell you off the top of my head. Right? Good luck to you. Hello, Margot. See, good evening, Dr. Ross. Happy belated Easter and Passover. Thank you for your webcast. Thank you. I try to attend on a regular basis. I recently bought my second supplement from you, the Japanese knotweed. Is this an either or with the oregano, cinnamon, clove supplement? I'm now taking the capsules. I see the knotweed comes in drops. How many drops as a started dosage along with the cinnamon, clove, oregano? Or should I stop the cinnamon, clove, oregano? I seem to have majority Bart symptoms just once a month with fatigue, elevated blood pressure, and flu-like symptoms. Currently hot flashes, disturbed sleep, AM palpitations, mild elevated blood pressure. Do you recommend Psittacodohutinea? How do these herbs affect hot flashes, blood pressure? Do they increase either of these two conditions? Your professional guidance is greatly appreciated, as I'm proof of someone that has greatly benefited from supplements you prescribe. Okay. So I may not be able to get into all of the nuances of your question here, but I'm going to make an observation for you. Let's see. I'm trying to see how frequent your symptoms were, and bear with me. I'm happy to read back through this again. Oh, okay. So I'm not sure you have Bartonella. And let me try to round that out. Okay. All right. Having said that. All right. So when, in terms of tick-borne infections, and in terms of the different ones, the tick-borne infection that gives you cycling of your symptoms on a monthly or every 2-month basis usually is Lyme infection, actually, which is Borrelia, not Bartonella. Usually Bartonella symptoms are pretty persistent and they don't come and go. Lyme symptoms, Borrelia symptoms, on the other hand, can come and go. And there are a variety of people that will have a flare in their Lyme symptoms on a monthly basis. There's theories why that can happen, but that's what we see, okay, is that they flare on a monthly basis. So when I see somebody that's having cycling of their symptoms on a monthly basis, I usually find that's more related to Lyme rather than Bartonella. Okay. Now, keep in mind, if you've been diagnosing yourself based on symptoms alone, symptoms of Bartonella, although there are certain ones we attribute, some of those cross-lap with Lyme symptoms as well, too. And in situations like this, where I'm trying to get some clearer picture of what's going on, if you have not done so, these are situations where it's not clear that sometimes you want to get testing to figure out what germs you actually have. For Lyme, my favorite test to do these days is to get a Lyme immunoblot method through IGeneX. and also for Bartonella is to get the Bartonella immunoblot method through IGeneX. For the Lyme side, that test is very sensitive. It'll find Lyme if it's there about 90 to 95% of the time. On the Bartonella side, it's very sensitive, and we'll find Bartonella if it's there about 90% of the time. So if you need clarity about which germs are really there, consider retesting or testing if you have not done so, okay? Because there can be symptom overlap, but the cycling of your symptoms you're describing here makes me wonder about Lyme as opposed to Bartonella, all right? Now, can you take Japanese knotweed and cinnamon clove oregano capsules together? Yeah, they both treat growing and persisting Lyme, and they both treat growing and persistent Bartonella. And you can make a treatment exclusively out of those if you wanted to. I have done that before with some of my patients, okay? In terms of doses, I would do 1 capsule twice a day of the cinnamon clove oregano. And the way I start the Japanese knotweed when I do it this way is usually I'll start at about 5 drops twice a day with my patients, and then have them add 1 drop per day per dose until you reach 30 drops twice a day. Okay, so what that means is you start at 5 drops twice a day. The next day you go to 6 drops twice a day. The day after that, 7 drops twice a day. Okay, so that's kind of what I'll wind up doing in there. Okay, so I think I answered some of the key parts to your question here. But yeah, all right. Good luck to you, Margot. Hello, Marcy. Let's see. My 17-year-old daughter just tested positive for Lyme. She has been detoxing from mold for the past year, and there have been many symptoms. She had a sudden aggressive period of pain after a wrist fracture. This led us to get the test because the pain was traveling everywhere. What is the connection with mold? Her pain completely went away. Does it come and go? I think she got it summer overnight camp in Wisconsin. Okay, so the relation between Lyme and mold is that both trigger too many cytokines, and therefore you've got 2 sources that are triggering those cytokines that give you most of your symptoms, okay? It is also possible with mold toxicity that if you have it, it may lead to some suppression of the immune system, allowing Lyme to be more active. It's possible, okay? But that's what the relationship is they can look a lot alike. And often if I've got somebody that I'm treating for Lyme and they're not getting better, and it's not clear to me from the initial visit that they had mold toxicity because their history didn't say that they had black mold living on their walls, for instance. But if we're like 6 months, 9 months, year into treatment, we're making no headway, then I'm going to go testing for mold toxins with a urine test and see, is there also been mold toxicity contributing to their cytokine excess, leading to all those symptoms, okay? All right. Can you treat Lyme and mold toxicity at the same time? Absolutely, you can. You've got to be on your binders and whatever else you're using for your mold toxicity, and then you've got to add in things to start killing your Lyme infection as well, too, okay? All right. Good luck to your daughter, yeah. All right, let's see here. Hello, Colleen. Let's see how Dr. Ross. How long is it okay for someone to be taking herbal antibiotics at low doses? I herx easily, so I've stuck to 3 drops each of Cryptolepis, Cemento, which is Banderol, and Hutania for a number of years. Certain symptoms like joint pain have improved, but issues of low energy, fatigue, random stabbing pains, and sudden bouts of weakness remain. So after low dose treating Lyme, Babesia, and Bartonella, and full on treating Candida, my next step later this year will be mold remediation and treatment. Do you think it's okay to continue these low doses of the herbs through the fall? Thank you for your insights. So Colleen, yeah, I mean, some of these herbal antibiotic tinctures in my practice, I will use for 3, 4, 5 years sometimes on people that we can't be that aggressive. But I would say if you've been into a herbal antibiotic treatment for years as you have been and you're not getting better, as I mentioned earlier, by 6 to 9 months, I often will go ahead and start looking for mold toxicity to see if that is the main contributor to the symptoms. So yeah, you should look into that. Okay. All right. Good luck to you. Hello, Susan. Can you discuss endocarditis or Lyme carditis? Can you have it without vegetation showing in testing? Um, my understanding is yes, you can. And the treatment, if you've got a carditis, I usually like using doxycycline. I may consider actually using IV antibiotics in these kind of situations as well, too. Okay. All right. Good luck to you, Susan. Hello, Esther. Thank you, Dr. Ross, for your weekly webinars. You're welcome. They are so helpful to all of us battling Lyme. I have many questions for you tonight, so get ready. Which of the following are game changers, if any? Cystis T, ozone therapy, Lyme stop, Rife machines, DNRS, vitroacoustic therapy, bee venom therapy. Also, are IV antibiotics better than oral antibiotics? Okay, so let me try to address some of this. In terms of IV versus oral antibiotics, the chances for success with IV antibiotics is going to be about 90 to 95%. For oral antibiotics is going to be about 85 to 90%. So you got about 5% different chance of benefit, okay? The trouble is with the IV antibiotics is they come with a lot of risk, financial risk, usually because insurance is only going to allow treatment for about a month with the IV antibiotics, okay? And also the other risk is when you get IV antibiotics, usually you're going to have an IV line put in called a PICC line or something called a central line. These are IV lines that stay in place and they're left in for the duration of your treatment. Those IV lines have certain risk associated with them. Number one, they can get bacterially infected, and that bacterial infection can work its way into your bloodstream. The other thing that can happen with them is they can develop blood clots at the tip, and those blood clots can break off, float into your lungs, and cause something called a pulmonary embolism, which is a killing of part of your lung. Okay, so these are not good things, obviously. And they happen about 10 to 15% of the time over a 6-month period of time if somebody's on IV antibiotics. Increasingly, many of us have moved away from doing IV antibiotics, and most people pretty much use oral these days. You can still find people like Gemsec out in DC that builds most of his treatments around IV antibiotics, but the majority of us are not taking those risks these days. Okay, all right. Then, in terms of these other treatments, ozone, Lyme stop, Rife machines, DNRS, etc. They're all types of treatments that may give you some benefit, but I give them all low chances of benefit, okay? Well, not the DNRS. So Rife machines use electromagnetic frequencies to kill germs. And my experience is they help about 40% of people. Research data from my Lyme data, where they asked people that have done Rife who's gotten benefit, they report about 34 to 50% chance. Ozone therapy has about around a 40% chance of helping you feel better based on my Lyme data. But keep in mind, I don't think it's from killing germs. So there's been studies done looking at ozone. If you put ozone in a test tube full of germs, it'll kill all the germs, all right? So a lot of doctors have gotten confused and they think, well, that must mean it kills germs in a person, all right? But the trouble is, in people, our blood, which you're putting the ozone into, is full of antioxidants that neutralize the killing effect of the ozone. So there's been studies done taking that same test tube full of germs and then putting a small quantity of blood in it and then putting the ozone in, and there's no killing of the germs at all. All right. So, but the way that ozone can make you feel better is it results in better oxygen delivery to your cell energy factories called mitochondria. And you can get some improved energy factory action, if you will. Okay, right. DNRS is something that I like to use. So that stands for Dynamic Neural Retraining System. There's a part of and to explain that, so there's a part of your brain called the limbic system. And the limbic system is in charge of your drive to reproduce. It's in charge of your fight or flight response. And one of the things that can sometimes happen with the limbic system is when you have chronic illness, it can get turned into an on position. And the release of adrenaline and adrenaline-like chemicals can help then maintains the symptoms you have of Lyme. Okay. So I will sometimes use DNRS, and if I've got somebody that is maybe a year or more into their treatment, we're not making headway, and they tend to be a very reactive person, that every symptom they get really scares them and tends to perpetuate the illness, I'm going to look at either doing a DNRS, which is a system put together by Annie Hopper, or a technique called the Gupta method, which is more of a mindfulness Buddhist technique, to help them calm their nervous system and retrain the limbic part of the brain. Okay. If I've got somebody that is not all reactive like that, but yet we've done everything we can to get them well and they're not getting there, I sometimes still will do a DNRS or a Gupta method, because it can help retrain the brain limbic system holding of symptoms in the body, basically. Okay. And it can be a game changer for a lot of people. Cystis T, I'm not sold on. Lyme Stop is a clinic system. It originally started here in Idaho, and it uses kinesiology and magnet therapy along with herbal antibiotics to help a person get well. I see mixed results. There are some people that do get really well with it. I think the majority do not. That's just what I see. Okay. Bee venom therapy, the idea with that is there's chemicals in bee venom that may kill Lyme, but also tend to be very good anti-inflammatory, anti-cytokine. And there are some people that can get benefit from that. I think I give it a lower chance of helping a person. But having said that, I've had patients in my practice that added that on their own, and that was the thing that turned the corner for them. Okay. So anyhow, I can't say what's the game changer here. It all depends on the person. But in terms of things that have the greatest chance of a benefit, probably the DNRS, probably Rife machines, but again, only 40 to 45%. Those are the two ones I would pick out of that list. Okay. All right. Good luck to you, Esther. Hello, Courtney. Hi, Dr. Ross. I purchased the Cryptolepis to use alongside my antibiotics from your store to deal with persisters after reading your book. I'm having quite severe symptom increases on as little as a few drops 3 times a day, and I'm wondering what you would recommend as far as building up the doses when the response is quite extreme like this. Thank you for the wonderful Q&As. Yeah. So Courtney, it's interesting. So as many of you know, I do recommend Cryptolepis for a number of things. I recommend it for treating persister, Lyme, and Bartonella, but it can treat the growing forms too. Okay. And it's also useful for Babesia. In Babesia dosing, I have found what's effective is 5 milliliters 3 times a day. So really high stuff. Okay. In Lyme dosing, my resources still say 5 milligrams 3 times a day, but there are some people that I see in my practice that I'm only able to get on 1 or 2 drops twice a day. It can be very powerful in people. And what I would say is increase it using your Herxing as a guide. So if you're on 2 drops, or you're doing a few drops 3 times a day, and you're worsened by that, and within a few days, if that worsening doesn't lift, I would drop back down to 2 drops 3 times a day. And as you can, as symptoms go away at that dose, then try to go up to 3 drops 3 times a day. If you Herx, wait for it to pass before you start increasing again. Still stay on it daily, and then go up again. You may find, and some people find, you can't get up to the 5 milliliters 3 times a day. You may find you're only able to get up to 4 or 5 drops 3 times a day, and that's fine. You're still getting benefit from it. Okay. All right. Good luck to you, Courtney. Thanks for buying my book. Hello, Ricky. Hi, Dr. Ross. How long should you wait before changing treatment for tick-borne illnesses of your current regimen is not helping you improve? Thanks. So again, it depends what you're treating. So if you know you have Bartonella by symptoms or by testing, by 2 months, you should start seeing improvement in symptoms. If not, change. Babesia, same thing. If you are sure you have Babesia either by testing or by symptoms, and you've been on a Babesia treatment for at least 2 months and you're not seeing some improvement in those symptoms, then it's time to change. The Lyme germ's a little trickier. Again, I kind of talked about this study earlier tonight, but there's been a study done looking at how quickly do you turn the corner on Lyme. And what that study showed, and these people were put on 2 antibiotics, clarithromycin to treat intracellular Lyme and spirochete Lyme, and then also metronidazole or Flagyl to treat cyst Lyme. And in that study, by 3 months, 30% of people started having improvements. By 6 months, 60% started having improvements. And by 9 months, 90% of people started having improvements, okay? So sometimes with the Lyme germ, you just got to wait, okay? Now, if I'm in a treatment and it's Lyme that we're treating, Borrelia Lyme we're treating, and I have no changes at all in symptoms by 6 months, usually I'm going to want to change and get them on a different regimen just to see if we might start moving forward, okay? All right. Good luck working. Hello, Eileen. Thanks, Dr. Ross, for sharing your knowledge and taking care of us all this time. You're welcome. It's truly helpful. Do you know if Lyme or co-infections can cause goiters on the thyroid? My granddaughter has POTS and now has goiters showing up and growing rapidly. Thanks again for your help. So if by goiter you mean enlargement of the thyroid, and I think that's what you mean, not directly, but again, I'm thinking about this just a minute. I haven't seen it give goiter as you're describing here. I'll just leave it at that. Okay. All right. Good luck, Eileen. Good luck to your daughter. Hello, Laura. Hello. Thank you so much for all your helpful information. You're welcome. I had SOTIV therapy, 1 of 2 doses yesterday, first time for Bartonella and Henselae. Before that, I was doing your tier 2 Bartonella treatment approach, started in February with Hutania, liposomal cinnamon clove oregano oil, and lumbrokinase. Should I continue this treatment even after receiving SOT? So Laura, you may or may not know, but I don't believe in SOT. So I just have to say that. And so let me talk about it. So SOT, everyone, means supportive oligonucleotide therapy. And basically what happens is you are injected with pieces of genetic material, genetic code, nucleic acids that are supposed to get absorbed into your cells and block the ability of your genetic material well, how can I explain this? So basically, inside of your cells, there is an apparatus called a ribosome. And in a ribosome is where proteins are made, okay? So the way that this works is in each one of our cells, or even in germs, we have DNA. And that DNA has to be transcribed, turned into something called mRNA. And then that mRNA is taken out of the center of the cell, brought to the middle of the cell, where it's brought into these ribosome protein production factories. And the mRNA is interpreted and turned into a protein. What SOT can do is it can block the mRNA. It can attach itself to the mRNA, or it can cut the mRNA in pieces so that it cannot be interpreted and turned into the proteins that a germ needs to grow. And in theory, what SOT is doing is it's blocking the reproduction by interfering with protein production of the germs. Okay, that's in theory what it does. And that all sounds great. So there's this company called RGCC in Greece that if you send a blood sample to them, your doctor sends a blood sample to them, they claim without evidence, I want to be clear about that they can identify the germ that's in that person and the genetic profile of that germ, and then develop a genetic sequence to block the mRNA created by that germ, okay? The problem is with their whole approach is a fewfold. Number one, the test technique that they use to determine if you have germs in you is something called PCR testing. It's a way to see, do you have the genetic material of the germ in you? And we know in the world of Lyme that PCR detection only works about 30% of the time to tell you if Lyme is in you. And we think it's probably much worse when it comes to Bartonella and other infections as well too. When I have corresponded with RGCC asking me to tell me what is the effectiveness studies they've done on their testing technique to tell me whether they really can identify these germs, they wrote back and ultimately said that maybe their testing technique can only find it if it's there 70% of the time, but they didn't provide me the data. So first of all, I call into question whether they are able to detect what they say they detect, and therefore I question what they're sending back to their doctor if it's valid. Okay. Number two, this mRNA that they develop, your blood is rich in enzymes that are programmed to destroy any genetic material that gets into you. So even though they put this genetic material into you, we don't know if it can even get into the cell to do what they say it can do. And this company has not done any research to show that what they say it does it. But there's no research at all. None that's been conducted. Not even by them, not by an outside independent agency. So I know that there are some people that do this SOT therapy that do have benefit. They claim benefit. But keep in mind, any drug in the physician's desk reference has a 35% chance of helping you by placebo effect, right? So what that means is when we do studies on whether a drug works, we take a group of people and we don't let them know what we're giving them. Some people we give a sugar pill, some people we give the active drug, okay? So in this group that gets the sugar pill, 35% of people have improvements, but there is no chemical in it, okay? So maybe the reason people feel better with SOT is more of a placebo effect. So it's a very much an unproven science. Their method of detecting whether the germs are in you is terribly flawed and probably inaccurate. So I question what they're sending back to you. And we have no evidence at all. There's no science that's ever been done showing this works in Lyme. Now, I will admit there's SOT therapy for some viral infections. But in those cases, those companies actually had to show evidence to the Food and Drug Administration that their drug actually worked, okay, number one. And number two, that it was safe. And in some of those studies, for the ones that have been approved by the FDA, a number of them were blocked because of safety problems, okay? So I don't know what you're putting in yourself. And anyhow, so my comment is, I don't know what you're doing and whether it's going to work or not. And because I don't trust that it's going to do anything, I would still keep trying to kill your germs, because that is something we know has some evidence that it can do, that it can work, okay? All right. Good luck to you, Laura. If you want to see a full review of SOT where I've reviewed what the problems are with what RGCC is doing, let me just do a quick screen share here for you. This is the article, SOT Treatment for Lyme Disease, where I review the problems with the claims and other things that this company is doing, okay? Very expensive treatment to be doing without any proof and any kind of science that it can work. That's what I would say. It's very expensive. Yeah. All right. Good luck to you, Laura. Hello, Matthias. Hi, Dr. Ross. Thanks for helping us. I'm thinking about trying L-arginine, but I'm a bit worried about it reactivating viruses. I had shingles in 2008, so I am a bit unsure if it's safe. What's your experience with this? So, so where I have some experiences in working with HSV, which is herpes simplex virus, and cold sores and in genital herpes. And in those situations, I do see that arginine may result in reactivation of those. In terms of shingles, which is a different virus altogether, I don't have any experience knowing for sure or not. Okay. All right. Sorry about that, Matthias. Good luck to you. Hello, Jennifer. Liver inflammation. My LFTs went up after my second case of Lyme. I didn't see another part to this question, Jennifer. Hello, Lisa. Hi, Dr. Ross. I'm a practitioner in Maryland. Welcome here. Let's see. And I have a new patient who is 20 years old with no past medical history, was completely healthy until she developed an episode of psychosis. She has had 4 episodes requiring hospitalization over the past 2 years and was diagnosed with schizophrenia. In between episodes, she seems completely fine. We live in Maryland where there is a lot of Lyme and co-infections. Would it be reasonable for me to test her for Bartonella without any other symptoms, only the psychoses? I would hate to miss this and can't come up with any other reason for the psychoses after an enormous evaluation. So, yes. And if you're going to go, so Bartonella can give very extreme psych symptoms. Occasionally, rarely, you will see it as the only way that Bartonella presents. In other words, somebody won't have all the other symptoms we might expect with Bartonella. Usually they have some degree of fatigue, but not all the time. Okay. So yeah, I would go looking for it. I mean, the other thing I would, you probably have done this already, is to think of PANS or pandas and doing ASO titers and making sure you don't have a strep infection that set this off. But another possibility is Bartonellosis, just like this. In terms of testing, my favorite go-to test these days for Bartonella is the immunoblot by IGeneX. They've got some data suggesting that they have a sensitivity of about 90% at finding it. And the way they do their immunoblot technique is they are looking to see if you have antibodies against the genus of Bartonella, which means the family, everyone. In addition, 4 specific strains of Bartonella elizabethii, Vinsoni, Quintana, and Henseli. But keep in mind that we think that within the Bartonella family, there may be 15 different germ types that can give Bartonella symptoms. Okay. So if you were to do their testing and the genus comes back positive, but the 4 strains of Henseli, Vinsoni, Quintana, and elizabethii are negative, that means they got one of these other 11 strains. Because that test can detect up to about 90%, I think it's your best option to look and see if there is Bartonella there. Okay. All right. Good luck to you. And I'm glad you're here. Hello, hi, doctor. My son is 17 years old. I noticed that he has some stretch marks on his back. I'm not sure if these marks appeared because he grew up fast in the last 2 years or if they are Bartonella marks. How can I differentiate between them? Also, if they are Bartonella marks, but he has no other symptoms, is it wise to treat him for Bartonella? Thank you for your help. So again, generally, in a teenager that has grown fast, the most likely cause of these marks is growth, to be honest with you. And if he has no other symptoms, he's got good thinking, he's got good energy, no significant ongoing problem with joint pains, I probably wouldn't even test for Bartonella here. Okay. All right. Good luck to you, Hayam. Hello, Laura. Let's see. Oh, there we go. We already answered that one earlier. Hello, Barbara. Hi, hello, Dr. Ross. I only have Lyme arthritis in the knees. I have taken 2 months doxy and 1 month of amoxicillin and many herbs with no help. I was bit 6 months ago. I'm wondering if the infection is gone and I only need PRP injections now. So I think, Barbara, to give you the best benefit here, I need to ask you more about what symptoms you have besides arthritis in the knees. The problem is, if we look at data about even using a month of doxy, although it can be quite effective, it still fails 15% of people, okay? And so there is a chance that you still have Lyme if you've got this kind of pain. It's possible, but the chances of still having Lyme go up if you have other symptoms that suggest Lyme as well too, all right? Now, the doxy by itself only treats spirochete Lyme, which acutely may be good enough. But if this has gone on for a while, you need to start thinking about things to address. Actually, the doxy would address a spirochete and intracellular Lyme, but you didn't have any coverage for the cyst form of Lyme, so that might be needed. But anyhow, to answer your question, I need to know a lot more. I need to ask you a lot of questions about symptoms to see if there's any chance that this is more than damage to the joint. And is there any chance there still could be active Lyme going on there? Okay. All right. Good luck to you, Barbara. Hello, Daniel. Dr. Ross, I'm currently receiving IV Resufin ozone treatment for persisters 2 times per week. Do you utilize ozone with your patients? Treatment for 2 weeks, feeling better, but had herx as a reaction. Do you utilize ozone with your patients? So, Daniel, as I already said tonight, I'm not a big believer in ozone. I will use it to help give people energy, but as a germ killer, the evidence would suggest probably is not. If you take a test tube full of germs and you put ozone in it and put a little bit of blood in there, there's no killing at all because your blood is full of oxidizing agents or antioxidants that neutralize ozone, okay? In terms of IV Resufin, it does nothing for persisters. The agents that work on persisters, you can read about in my article on persisters, but they would be things like methylene blue, maybe dapsone, the herbal antibiotic Japanese knotweed, cryptolepis, cat's claw can, and then liposomal cinnamon clove oregano. Those are the main agents that have some evidence, and also disulfiram can be useful for some with Lyme. Persisters, however, it's got a major side effect profile problem. Okay, all right. Let me just do a quick screen share. Well, actually, I showed you earlier tonight, but if you go into my treatlyme.net site and write the word persisters, you'll find my article on Lyme and Bartonella persisters. Okay, all right. Good luck to you, Daniel. You also, there, you can look at my whole article about my review of ozone and why I say it's not a good germ killer. And that one, I'll do a quick screen share here for you. Okay. So in this article, I review oxidation therapy, including ozone, and lay out an argument for why it may help you feel better by helping your mitochondria work better, but as a germ killer, it's probably not the most effective germ killer. Okay, so take a look here. You can see the science that I looked at that says why that is so as well too. All right. Good luck to you, Daniel. All right, everyone. I think that's it for me for tonight. I've enjoyed being with you here. And I look forward to being with you here again next week. So next week, tomorrow morning, when you get the email from me that has a synopsis of tonight's webinar, it will also include links that you can use to sign up to next week's webinar. So I hope you'll use that to show up. Next week, I'll be visiting with you from Austin, Texas. Many of you know that I'm living in between Seattle, or between, I live part-time Seattle, part-time Austin, as I get ready to wind my practice down in May, and I'll be living then full-time in Austin. So we'll be talking from Austin next week. Keep your eye out for the email somewhere between 9:30 a.m. tomorrow morning, which will have links for the recorded version of the webinar tonight. It'll also have a synopsis of what that webinar was about. I hope you'll help me reach more people. There's a lot of people that can get benefit from these webinars. If you are, they can too. So if you know others that have Lyme and related infections, please share these emails that I send out with them and see if they might get some benefit as well too. Okay. I've enjoyed being with you here tonight. Good luck, everyone. And I hope you have a good week until we see you again. Bye-bye.